senior nursing student at Columbus State, and I'm just going to talk with you guys a little bit about doing a self-breast exam. So a couple of things to remember. The American Cancer Society and the Stephanie Spielman Breast Center, which is where we got all of the information for this video, recommend that women and men are doing self-breast exams once a month, and if you can do it at the same time every month, that is ideal. It doesn't have to be exact, but they do want you to try to aim to do it at the same time every month. There are two components to the self-breast exam. The first one is to look, and the second one is to feel. So the first one, you're just going to stand or sit in front of the mirror with no shirt on, and you're going to just inspect your breasts for any abnormalities in the skin, any dimpling, any redness, flaking, tenderness, any lumps or masses. You're going to raise your hands above your head and just kind of look underneath, lift the tissue up so you can see any masses or lumps that maybe weren't there before, and then again, dimpling or inversion or turning in of the nipples. The second part is to feel, and this is where a lot of people do this in the shower, or you can lay down. If you're lying down, the tissue in your breast actually kind of spreads out, and you can feel for abnormalities a little bit better. So what you want to do is put one hand behind your head, and you're going to use the opposite hand to feel the breast underneath the hand that's behind your head. So what you want to do is you want to use 3 fingers. You're going to use the pads of your finger to feel, because that's where you're most sensitive. And then you don't want to use 1 or 2 fingers, because that can actually spread out the breast tissue and you might miss something or feel something that's not there. So using the 3 fingers, you're going to also use 3 different pressures. You're going to use a light pressure, and then a medium pressure, and then if you can tolerate it, a firm pressure to really get deep within the breast tissue. And you can kind of alternate that throughout. So the surface area that we're talking about for where you're feeling is at the collarbone to beneath the breast, where you can start to feel the ribs. And then over on the other side, you're actually going to go all the way underneath your armpit. You're going to palpate underneath your armpit in the same motion that you're going to palpate your breasts. The surface area here is your armpit all the way down and then over to the middle of your chest. There are actually a lot of lymph nodes over here under your armpit that you want to feel for. So using your 3 fingers, you're going to do one of 2 techniques. So you're going to go up. If you can look closely, there are arrows on this mannequin. I know it's kind of hard to see, I'm sorry. But you're going to follow the arrows up and then down, just making sure you're getting as close as possible so that you're not missing any of the tissue. And again, you're going to do that under your armpit. So you're feeling your armpit the same way that you would be feeling your breast, and all the way down to the middle of your chest, and then again, collarbone to underneath your breast. The other technique is to, still using the 3 fingers, you're going to go in a circular motion around the breast, and again, above the breast to the collarbone, underneath, and then on the side, armpit, and down to the middle of the chest. The American Cancer Society also recommends getting a mammogram when you turn 40. If you have a family history of breast cancer, you're going to want to do it a little earlier than that, depending on when your family member was diagnosed with breast cancer. So what they usually recommend doing is taking the age that your family member was when they were first diagnosed with breast cancer and subtracting 10 years, and that's when you'd start getting mammograms. So for example, if your family member was diagnosed with breast cancer at age 40, then you would start having mammograms at age 30. Those are just some tips that we wanted to share with you guys regarding prevention and screening for breast cancer. Really important for men and women. And again, we got all of the information for this video from the American Cancer Society as well as the Stephanie Spielman Breast Center.
Hi, I got a call from Allison that Brian was diagnosed with breast cancer.
What? I didn't know men could get breast cancer.
Yes, I guess even though it's very rare, the incidence is much lower than breast cancer in women, less than 1%, but men can get it too.
Wow, I had no idea. I felt like most men do not know this.
You're right. I think there should be information provided at your yearly physical, like discussions about testicular and prostate cancer. I did do a little research, and they said that men often go undiagnosed and do not notice symptoms until the disease has progressed. I did read that if information was more inclusive, that men would be able to get diagnosed earlier and therefore get treatment earlier.
It would be nice if we had the reading material like this in the doctor's office while we wait. I just always see information about women.
From what I read, men should do monthly breast exams like women. If they do, they would be more likely to find their lump sooner because they have less breast tissue than women.
This is very interesting. I'm sorry this is the way we're learning about this.
I know, it is sad, but at least this way we can educate our other family and friends and make more men aware.